Welcome to week 7 and the second to last week of the analytical figure drawing course. This week we're going to be talking more about the arms, and it will also lead into next week where we're going to continue to talk about the arms. I think it's good to break this lecture into 2 weeks. The leg lecture gets a little bit long for that 1 week, and to break the arm into upper and lower is pretty valuable for just being able to get a good sense of what's going on and not have to throw everything in all at once. We'll start with a brief review of the landmarks that we'll be using for today in designing. So remember today, head of the neck, clavicle, chromium process, scapula on the back, creating the pivot or socket area for the arm or the head of the humerus. Also, this coracoid process is going to be an important area to identify for the anatomy. That's that small area of the scapula pushing through. Sternum, of course, manubrium, this shape, all important stuff. And so today, to understand even the pectoralis is important, as it's connecting and utilizing or working the arm, as would the serratus or latissimus or trapezius. So just about everything that we talked about on the first week of anatomy, which was to here, is something that we would want to think about for today. So what I would encourage you to do for homework is to draw the entire rib cage, scapula and all, on the back in order to start thinking about the anatomical adjustments made to the humerus. So that's what we'll start out with, is trying to think about how you can reconceptualize some of this structure in order to use a perspective framework to understand the arm. And then to the thoracic arch. So we're not really going to go much lower today. On the back, we have the spinuous process, the spine, the posterior superior, and for the scapula, medial border. This is going to be important when we start to look at or this area in particular, the rotator cuff, spine of the scapula, and then the head of the humerus. So all important stuff for today. Specifically for the arm, here we have the front and the back, clavicle, chromium process, review from the previous slide. Here's the head of the humerus. An important area to notice in the bone is this, which is the bicipital groove, and the head of the humerus. We're going to see one of the tendons from the bicep connecting here. You can also notice in the bone this area, which is kind of a raised area with an irregular surface that the deltoid, or the tendon for the deltoid, attaches down into. And so we also see that here. So just a good point to be aware of on the bone. Flipping the other side, 2 areas we already looked at, medial border, and we're going to start with looking at anatomy that's attaching here and moving out, underneath the spine of the scapula and above. Into the length of the arm, we have a lateral and medial epicondyle. Here this is a smoothed or smoother surface to allow for some of the forearm muscles to begin and connect here. This is much more angular, and our funny bone. So I'm going to design that in our kind of conception of the bones as a curve versus a straight or a sharp. Then into the forearm muscles. First of all, though, you can see that reproduced on this side. Sharp, curve, ulna, which is our hinge joint. That's what's giving the flexion and extension, the open and closing like a door, and we can follow that all the way down through the ulnar furrow, which is this, or indicated here with this red line all the way down. Also a great way to help kind of see the divide between flexors and extensors, or at least some of them here. Ending in the styloid process of the ulna and radius. One thing that's kind of worth keeping in mind even early on here is the way that the ulna from this side is kind of bent. You can use some of the anatomy that we'll talk about in the second week to kind of rationalize this angle shift. But do keep it in mind, right, that you design this as an S or with some shift in angle. Styloid process for the ulna, much more noticeable. We can see this on our wrist very easily. Here we get this kind of covered over with some of the muscles that are moving down and into the thumb. So we get a little bit of softening there. But the box form still can be constructed from the wrist, or that 2x4 form. Same thing for the front view. Excuse me. This would be both supinated positions, where we see the radius and the ulna more or less moving parallel to one another. Pronated positions would start to see these two crossing. Supination, the thumb points away. Pronation, the thumb points towards the inside of the body. So those are our major landmarks for today, and just a few sketches from Da Vinci to start us off by showing how he was very invested in the anatomical makeup and study of the arm. Okay, so let's get going with thinking through some of the landmark elements into the design. So I've taken the liberty here of laying in some stuff. What you have are just some views that we'll do. This is front, side, and back, just a turnaround of the arm. Again, it's one of the best thing, I think, for creating this diagrammatic quality that you can then later start to develop into some variations on a movement. And in that sense, I can help you again with the homework to try to clarify some different positions. And picture of Bruce Lee that we can kind of analyze our form with as we start, and then just a reminder for the process. Shape, everything in the arm today is relatively sphere, ovoid, or egg-like. Placement will be the reason for having set up these different views. Gesture, very much like the leg. I just got, in the sense that squash and stretch of these shapes. So to pull them apart or to activate the muscle would cause for a C or S curve respectively. And then the perspective, which gets a little bit more difficult this week because we are thinking now about building on very slender forms. So that's the review, something that we've spent quite a bit of time thinking about as far as a process, and we'll do our best to reinforce it again. So let's go ahead and place some of these landmarks, and what I'd just like to present is how I'll sometimes use the shoulder girdle. So the shoulder girdle is a unique perspective. I'm just looking for a place where there's enough room to draw. Okay. Shoulder girdle is the idea that the clavicle, scapula together, as they meet up, present and develop a different perspective. So these are in addition to the rib cage. And we know this to be true because whenever you move your shoulders, your rib cage doesn't have to go with it. We can swing our shoulders independently of the rib cage. So I'm going to think of them very much like their own perspective. This is why a lot of the time you may think that you see on top of the rib cage, when in fact what you're really seeing is on top of the shoulders. So they do kind of lean forward, and as such would be seen from the front on top, like we have here, and the reason for the photograph. This is the volume that I like to think about in order to use for the shoulder structure. And so let's consider this as a whole, and then I'll take some time to point out how it is that I see this. And I find that it's pretty useful from the front. I don't use it as much from the back, so I'll talk a little bit about how it's different there from the back. But first of all, let's set it up. Let's talk about how I actually will find it and use it. It's always based off of having found the landmarks. So let's go ahead and lay those in. Here for this rib cage, I have my pit of the neck. Here's my clavicle. So I want to remember that this is going, roughly halfway in. Clavicle on this side, we're seeing more because of the turn of the pose. And then here's an idea for where the scapula would be. 7th cervical vertebrae in the back. Okay, so it's really all of these things that allow me to understand where the shoulder structure is. And I think of the pit of the neck as being perfectly center to it, and roughly about where the top of this box is, or the top of that bridge shape. So what this will allow for is a tilt. And your shoulders are also going to tilt two-dimensionally in a different direction than the rib cage. So if I take this, just like I have here, and run a straight line across it, it allows me to kind of think independently a tilt that doesn't have to be the rib cage's tilt. And so that's setting up my first line here. The second thing that I'll do is think about that paralleled by the 7th cervical vertebrae, which is higher. Remember, that's something that we've talked about already, how the back of the neck is higher than the front. And now that I have these two lines running parallel on the same tilt, all I need to do or have to think about is relating them with a width. So I'm going to drop this line. And now what that kind of suggests is the forward lean of the shoulder structure and how it gives us a different perspective. I think you could see that here pretty well. So how this is kind of leaning forward. We're seeing a lot of the top plane. Maybe the plane, the trapezius is building up and off, and then this really is kind of leaned forward. And this is where we're going to go with this. And then we have the rib cage under. So pit of the neck, clavicle, scapula on the back. If we take a quick look at that from the side, again, the idea here is that we're trying to show with asymmetry and perspective the idea of another counterbalance in form. And if you're using this from the side, what I would be thinking about here is the pit of the neck and then how it's moving around the rib cage. So I'm just going to sneak in a little bit of a wrapping line there. This is going to be parallel to whatever angle I've decided on as being appropriate between 7th cervical and pit of the neck, and then this is something that represents now for me the scapula. Sternum. When I use the clavicle to pull off the pit of the neck, I'm generally going to think the clavicle is somewhere midway in the overall structure. And then that's going to allow me to kind of think where the positioning of the arm would be. So let's follow that through, continuing here on the front. This, like we did on Bruce Lee there, the height of this overall structure is going to be leaning back. And that's supported by the example we just looked at on the profile view, how we do have that lean. And I'm going to repeat that here. And this. And that pretty much gives us everything. I can repeat the width. When I use this in the front, I am going to curve this space out. There's this bridge shape. That's where I want the rib cage to be able to kind of intersect or fit in to this. And you could kind of think of this like shoulder pads that a football player would wear. So if you want, you can start with a generalizing line, but then I'm going to think about this form coming over. Now it's hitting the rib cage, so it's moving up. It goes across, and then it goes back down. So that would be our form. And I think pretty valuable for establishing an organized form to depict perspective. It's not one of those things that you have to use forever, but it's something I recommend to my students just to get started thinking about really organizing the planes and then building the muscles from there. The other benefit is that it could move. Right? I can take and change this structure. It can swing, it can move across the rib cage. We can move our shoulders independently, like I said earlier, so I could much more easily take this independent structure and kind of mobilize it or swing it around in a different direction. And if we were to design it from the front, pit of the neck, And of course we don't always have our shoulders doing the same thing, so you could also think of this center point here as a functional type of hinge, right? And you can have part of this swing up, so you can lift the arm, this could raise, all of it collectively, and it's going to allow, I think, for a much more easily understood system or presentation of plane that anatomy can, in a simple way, kind of be approached with. So that gets moved up. The only thing I might do a little bit differently here is just show a one-point perspective, so that I'm implying that they're going to be ending. Here's the neck or throat. Moving back. So here's you can see that I've built this small section for the bridge based on the height of the pit of the neck, and then over. So just another way to conceptualize the bones into a perspective. And if I'm going to now take a look more so at the back, this is something that I really do tend to use more so from the front. So from the back or from the side, I'll use this. From the back, not quite as much. So what I do like to use from the back is just the scapula. I think the scapula we can really get a lot of the form and perspective, or the suggestion of, from the scapula alone. So here's our spine. Scapula, remember, is that we talked about the shape, the triangle shape that has the second triangle on top, and then the S. Those are our three design components for it. What I'm going to be thinking quite a bit about is this. So the straight line, I'm always going to change now to a curve or rapid line that will conform to this perspective. And the perspective that I'm thinking about it conforming to is all of that of the rib cage. So you could set this up with boxes if you're a little bit more confident in the articulation of perspective and space. It could just be kind of this more organic form with wrapping lines, really however you want to address. It's really based on your level of comfort and skill set presently. So this is going to have to, in some sense, repeat the form of the spine, which has kind of dictated the overall impression of the forms. So I change that, and if I have any movement off to the side or forward from this view, I'll change the width. So for this, here's my scapula, about a head size, and now this curve is really trying to tell the story of that form. Let's say this one is kind of more oblique to us, so it's almost exactly what we drew. This width is going to get really very little to no change. This is a straighter line curve. Here's that triangle on top, and then the S curve. And let's bring some of this in just slightly. Got a little carried away with my rib cage. Now I'm into thinking the head of the humerus and then the clavicle. If I have something that's a little bit more perspective or a little bit more foreshortened, here I would try to show the inside. So I'm trying to determine or show the scapula with some width, and then I'm going to decrease the amount that I show for the width on that side. So that's the kind of the simple way of presenting, and still getting good perspective based on very simple concepts like the wrapping lines, or in this case the wrapping line and the overlap, because we're showing this in front. So now is the point where I would generally like to ask for questions, which is something that is a little bit more challenging in this kind of forum. So something I probably should have suggested earlier on is to take notes as we go along, and even if it's kind of retrospect or in retrospect now, you're going to go back and view some of the videos. And it's always good to take notes, and then it may just be a way for you to ask questions later on when we have the opportunity to kind of interact directly or through email or your homework, so that you make sure you get everything correct or answered. That may be more unclear than I would prefer, or I may make a mistake in one area, and you have a question that may help clarify anything, just to make sure that you're getting absolutely everything from what we're talking about. Okay, so that is our shoulder structure, and I think an incredibly valuable way to address or start to work into the arms. It's from this point that I would then start to add the arms themselves. You can start with the bone, kind of like how we've laid out there, or go right into the cylinder. And what I'll do for the cylinder is just stack it right next to this plane, because I'm going to be connecting muscles to this form from just about every surface, front, top, back. So to have this just right next to is going to be pretty valuable. The arm isn't going to be, remember, as far as the length, any longer than the thoracic arch. And so I'm going to think about keeping this kind of on an arc. I could bring it up a little bit. Here, same thing. Maybe I think about the cylinder just kind of being stacked right next to, and then what we'll do is use the anatomy to kind of soften all of this. So do keep in mind that this would all be kind of drawn or considered as the size of the skeleton, because I want to be able to build on top of this and hide it. Same thing from here. You can just kind of think about a gesture or the arms developing from this point, and then same thing from here. Today from the back though, maybe bring that arm just a little bit more so into the scapula, since we're not using any of that kind of rigid architecture from the back. Although you're certainly welcome to try. If that form, or this form here, feels as though it would be something useful. The only difference from the back, of course, would be that we would be seeing under, and that we wouldn't be seeing a top plane because it's leaned forward. So to give a small kind of demonstration of how it would appear in this view, slight under, just to show the width of the scapula or the thickness, and then spine, so rib cage would go here. And I would be thinking about the plane on the back represented by the scapula, chromium process, and then humerus. Beginning the arm, and then that's what we're going to try to work on today, is maybe doing the scapula muscles and then a few muscles of the upper arm. And we'll work next week more so on finishing the forearm. Okay, so that is our setup. That's the way that I would start most all of these drawings. That's really trying to get in touch with what's going on with the arm. What we'll move into next now is taking a look at the muscles of the scapula. And I'd like to spend more time to really think about what's going on here and how they're working, and then move into the humerus itself. Okay, so the muscles of the scapula. So we already know some of them, and we know that, for example, on the back, we're going to have, connecting the scapula into the spine, the rhomboid. So that's one of the muscles we talked about that's having an antagonistic relationship to the scapula. I'm sorry, the serratus. So we have this pulling the scapula up and in, and then we'd have the serratus connecting under, and then pulling this down and around to the front. So that's one thing to keep in mind, that are the kind of larger movements now of the scapula. Now we're going to talk about the scapula as it intersects into the head of the humerus. So this is going to be the big theme, is understanding how this and this is affected. And there's a number of things that can take place here. We can have the muscles of the scapula helping with ab and or adduction, or we can have medial or lateral rotation. We can have the arm spinning back. Or forward. So that's a good amount. It's a good amount of information for a few muscles in this area. So that's what we're going to try to focus on now, is how that's working. So what I'll do is kind of write the muscles off to the side here. So the ones that we're going to be concerned with, sorry, that should be a P, is the supraspinatus, the infraspinatus, the teres minor, and teres major. So all pretty important muscles, especially teres major. Right? That's one of those really valuable muscles that people kind of overlook quite a bit, that plays a huge role in the back. And so we'll place that. To start here, all of these muscles are going to be egg-shaped for the most part, with some variation. The supraspinatus, what we're going to be seeing is a connection with a muscle back in here, and kind of like an egg, pulling and sitting on top of the scapula. That's going to be pulling through, down, and then connecting here. There's a little bit of a hollow here that you could see the muscle tendon going through. So just basically kind of thinking about this in a very general way, for the muscle to be connecting these 2 points, what is arguably a position here on the scapula against a position here on the end of the head of the humerus. If this muscle now changes and becomes active by increasing its mass, it's going to take this point and pull it in. Right? So this is going to be helping with which one? Abduction, right? Because it's helping take the arm away. Right? So in ab or adduction, we're still thinking about this versus in. So here's some overlaps, and we know that this is also going to be covered over by trapezius. So it's going to be hidden underneath that muscle, but still really important to get a sense or to build a relationship to. The next one is the infraspinatus. So supra, kind of remember supra is a prefix that can mean above or over, infra, under. And this will be one of the exceptions to that design of everything elliptical. The infraspinatus is, to me, much more kind of triangular. So it's going to be attaching on the back of the head of the humerus, underneath, and down. And this is one of those muscles that does not get a lot of volume built to it. So when we see comics or heroic characters getting this muscle with tons of veins and development and size, it's kind of a little bit unrealistic in the sense that it's already unrealistic to begin with, but also this muscle doesn't gain a lot of volume for its growth. It would almost always be kind of a generic straighter plane, and we're not going to see that change a whole lot. So I'm thinking about a triangle, and then I'm just trying to give it a little bit of depth. But most important, really, let's continue to kind of build that idea of our understanding surface form. I don't want to pretend that this is an anatomy class. Here is a volume, so let's understand how we would experience volume here and moving around. and there's our infraspinatus. So infraspinatus, based on its position, so here, back of the scapula, and here, head of the humerus, is going to be adjusting or articulating that head. So that's what everything is doing here. Everything is in some sense trying to operate or exert an influence on this ball and socket joint. This, when we already talked about moving up, abducting, this one, supraspinatus, doesn't really do much for either of these. You can see it's kind of not at a great position to do so. This one will help. So it can pull. If we think about the striations as a way to think about how the muscle works, it's going to be bringing these 2 points closer. So it's going to help. Spinning the arm back and in. And so we get this rotation. It's also going to help with adduction. And so if we think about the arm being up or raised, this is going to start to pull back down by its position on the head of the humerus there. Okay, so the next one we'll do is teres minor. Teres minor is more or less right underneath the infraspinatus and is kind of a helper muscle. And so we're going to see it in here. Big shape, or kind of longer elliptical shape. And then we're going to leave a little bit at the bottom for the teres major. So teres minor, essentially repeating much of the function of the infraspinatus, if not all. And here, again, let's think about how our building form around, trying to get this volume. So if we're thinking about this analytically to design, try to remember or think about ways that you can make that possible. If we have here the head of the humerus, look at how all of the lines for the muscles, where they're beginning or they're sizing, all have a really nice repeating pattern. That's one of the things that I would study anatomy, or I've tried to study anatomy for in this class, is to break things into simple design formulas or shapes that you could later use for your work. Then we would get here a nice kind of swing through, and then we get an asymmetrical movement more so based off the teres major, which would be next. So spoke wheeling is kind of a common compositional principle or unifying element, and we could use the same thing here in the body. So last but not least, we're going to have the teres major. And the teres major is going to be creating, along with the latissimus, the back wall of the armpit. And we're going to see this muscle moving to the front. So it's going to make a big, pretty dramatic change here. From here to front. And so up in this area. So here's my big volume with the teres major going to the front. And so we get the idea that it's grabbing there. Let's do a little bit with the outlining to show overlap. Another big egg-shaped muscle. Here's our form. This one really trying to show a cross. And this is going from the back of your scapula to the front of your humerus. So we're going to have more of a perspective difference in this muscle than we would in these, which are just really moving here. And teres major, so teres major, is going to be doing a lot of what is, up until this point, not taken or not accounted for, such as forward rotation. So now we have this point here to the front, it's going to spin the arm inwards, right, or more so around, consistent with that. If these are all adducting, helping pull the arm back down, this will also still do the same, but it is offering a difference in our principles of rotation. So that is our muscles that we'll have in the scapula. We are going to have these covered over, and you can guess what will be covered by. Something we've already looked at, the deltoid. So this is the big abductor. Here's the tendon. This would be the distal head. Swinging over. Big shape. Connecting. And then medial. And then proximal. So we would see not all of that. We're going to see a lot more kind of this particular area, but still good to know nonetheless. Crucial to know, actually. And then we're also going to have latissimus, which we'll remember underneath and separate from the teres major, also moving up into the armpit. So that's just to bring back some context from the rest of what we've looked at. Trapezius going there, rhomboid, trapezius covering rhomboid. So that's our muscle. Okay, so with that in mind, I think we could probably get a few more muscles in for this week, just to start to rough out how we're going to see the arms, the connection from the scapula into some of the bigger muscles here, and then we'll let our last week be a little bit shorter and allow for just a focus on some of the forearm muscles. So what we'll do next is start to talk about the coracoid brachialis, bicep, tricep, and brachialis. And then that will be the extent of our studies for this week. Okay, so we've worked our way through framework and structure to support the shoulders and the thinking of the entire skeletal structure around the rib cage in perspective. We've done a little bit briefly here to indicate some of the muscles that move from the scapula into the humerus, and now we'll look more specifically at what's on the humerus. So if these are adducting or medially or laterally rotating the humerus, these will be more so about flexing and extending the muscles, the radius and the ulna against the humerus. And let's jot down which ones it is that we'll be discussing so that we can assign them all a shape that can be analyzed and designed. We'll talk about the coracoid brachialis. And again, one of the things that concerns me here is that there's only enough time really to present these general type of unifying ideas. So again, the best thing I think I can do to supplement for that is I'll do my best to post a good amount of drawing on the website or the class blog so that you can see maybe different views or the muscles or different situations in which muscles will take different shapes or diagrams. But I think that might be the best alternative, other than, of course, correcting any or giving you advice on any of your homework assignments. And I'd also like to talk about the biceps, the brachialis, and the triceps. And for this week, I'm wondering if it may be best to only do a few and then pick up where we leave off for next week, but we'll see. Okay, so let's begin by looking at the coracoid brachialis, and I do believe that I have some images that we can look for. We'll come back to that in a second. Don't think so. Oh yeah, here we go. This is what I was looking for. So these are the ones that we're going to start out looking at, the under or the interior muscles, and then we'll build on top. This here is the coracoid brachialis. So again, brachialis in Latin reference to humerus, coracoid process. So again, we get the muscle telling us specifically where it is going, beginning and ending. And what this is going to give you is a pretty important design for the inside of the arm. So if we see, for example, the arm bent, this would be the deltoid, this would be the pectoralis, we would see the bicep, and our arm here is bent, so it's more of a teardrop shape in its flexion. And tendon pulling, so we have our lower arm up. The coracoid brachialis you're going to see in here, just like this. The one that we're looking at here is the brachialis. So that one, or this muscle, is underneath the bicep and is kind of the pillow muscle. Right? It's a pillow for the bicep as it sits on top of and separates it from the humerus. You can see it starting lower. This muscle starts almost where the coracobrachialis ends, so it's kind of like a pickup or relay there, and close to halfway, so we're also going to see the deltoid ending right in here. So we have coracoid brachialis, brachialis covering a lot of that, but here maintaining that harsh surface on the outside of the medial epicondyle. This is pulling into the humerus. I'm sorry, the ulna. The bicep is going to be attaching to the radius, like what we can see here. So let's kind of fill out what else. And we were to present the flexed arm. The brachialis would be seen here. So we have it underneath the coracoid brachialis and the bicep, moving to the ulna. And then the last part we're going to have to show will be the triceps, again coming from here. This would be the long head. And then we're going to see a subtle plane shift for the medial head. And then we're at the sharp, the elbow. So there's my lovely drawing of the bicep or the arm bent for shape identification. Okay, so this is brachialis, or I'm sorry, coracoid brachialis, and then brachialis. And let's go ahead and put those on our drawing so that we get a sense here for how to design them, brachialis and coracoid brachialis. So these two are down, and let's go ahead and throw them here. So one of the things that I mentioned was the halfway. That's pretty important for setting up some of these things. If I'm going to start to build stuff on the humerus, let's just keep in mind here the importance of establishing the perspective. So I've kind of left that out in some of the diagrams as it's just becoming a little bit more here about placing the bone and the muscle. I feel like I've kind of reinforced this, or we've emphasized it quite a bit. But here, remember the shape for the brachialis would be starting around. I would then lay the volume on top. And then I would try to do the same thing here as far as its connection. How does it relate prospectively? So this is something that we can't neglect, because the goal and the way that I see analytical figure drawing being valuable is then exploring how that form develops and builds. Okay, so coracoid brachialis first. Here is a coracoid process, and then shape. Okay, so we know this is going to get covered by quite a bit. The pectoralis, deltoid, bicep, but we still want to think it underneath. And let's see, we're going to leave it out from the other views, as I don't think it'll be visible enough here or here when we start to cover on top. So really do think about it from the front, and then especially in that flexed position. The brachialis, so let's make it a vomitous green, like a dirty Hulk muscle, and that will be here. Right, so that's starting. We're also going to see this from the side. and the shape is here. Remember we saw how it is larger and kind of becomes teardrop-like as it moves down and into the ulna. So here's our pillow muscle. And now let's get some overlaps just so we have a clear idea of the relative placements based on our space. Attaching, behind. And attaching, so let's cheat this so that I'm coming back to these ideas. Building, so we've sculpted this now on top and into the ulna. So this is going to raise the ulna. It's going to do it from kind of a different position, obviously, than the bicep. It has much less leverage here than the bicep, which is starting up high and then connecting there. So this will be something that begins a movement. Whereas you can think of the bicep as kind of having the power and placement to complete a motion, or complete the motion of the arm. And brachialis from the side. Right, we're definitely going to see this muscle from the side of the arm. Remember, it's in here. That's my halfway point. I'm thinking about where the deltoid would be ending. And then I'm going to stack it. See it on the side. And then here in front, I'm seeing the radius. So this is going to overlap and go to the other side. This is stretched. So remember, my stretched muscles are getting a nice long S-curve. In this view, we would see the triceps used. So let's take a second to work that out. These flex the arm, extend. So to organize how we understand those, let's make just simple diagrams up here. Here's the arm extended, and then here's the arm flexed. The way that I'm going to organize my shapes, brachialis, bicep, stretched. And so we have a nice S-curve in this flexed position, but what is active and bringing the arm down or extending is the triceps. So here would be my design for trying to keep a nice kind of asymmetry in between the two that communicates the realistic sense of how they work. This is different. So now I have these pulling. So we're going to have the brachialis and the bicep becoming much more C-curved, pulling up. Triceps thinned and stretched. So here designing the S, here the C. So trying to keep those early principles still relevant and active. So remember to do your best to organize the shapes in that type of sense. And hopefully there's enough difference there that makes sense. So still working with our flexors. One more thing before we get into the bicep is just the overall form of the arm. And I think you can find really helpful suggestions for how you think through the perspective of the arm from people like Bridgman or Hogarth. Always really nice form suggestions. But one thing that's worth pointing out is the volume of the arm. And since we're kind of specifically looking at the area of the humerus, I try to think of this area as a wedge shape, and that the arm is going to expand into the back. So this is just to generally reinforce in a lot of my more beginner students how the bicep isn't the size of a Volkswagen. We all come in with an experience from comics, which is good, because we're all excited about the human anatomy and drawing. Sometimes you just have to get over some misconceptions. The bicep isn't gigantic, it's thinner, and the middle of the arm, the humerus, is going to expand in size to the back. So the tricep is going to be most of the mass or the volume of the arm. So just keep that in mind as something to help organize how you're thinking about the overall sense of form. Tricep to bicep, and then we're going to have brachialis here in the middle. Not all the way up, of course, but it'd be more down here. Okay, so that's just something to think about as we develop these more form-based issues. So let's go ahead and now think about the bicep as something that is going to be on the front of the arm and right here. So we obviously know it's in the front of the arm. The bicep is going to attach to the radius, and then you can see to the right and down here that it has a tendinous expansion that's going to grab the skin around the elbow. And in a sense, this area is lashing down some of the flexors, so in here. So it's an important area to be aware of, as it does make some kind of unique surface forms there. And again, remember when we're thinking about this area of the form, the bicep is still relatively small. The triceps are 2/3 of the arm. So we're working on what is essentially the 1/3 here. Bicep as a shape. So you can see there's a long head and a short head, both connecting to the radius. This is a really important muscle for thinking through the supination and the pronation. Bicep is very helpful with that. Here's the tendon going through the bicipital groove of the humerus, and so that's that area I pointed out early on. Just kind of snaking right in through there, and then attaching at the coracoid process, as is the other head. And so we have this kind of loop suspending both muscles. So we have the size of the two, and then the integration into the radius and skin through the tendon. So this is also, of course, sitting on top of the brachialis. So you get overlaps there. Okay, so let's include this, and then I think that might be a good stopping point for the week, to allow you the chance to work on just the muscles of rotation and flexion, and then we could start next week with the triceps and the flexors and extensors. So bicep. Bicep as a shape. Obviously we've talked about how it looks pinched and stretched, and we just looked at the anatomical plate. I'll usually use an egg that is concluded with a triangle, and then here kind of a loop shape on top. If you want, you can split it, but I probably wouldn't go much further than that to be kind of general. And let's include it here. So up through the bicipital groove, hitting the coracoid process, and then down. And the overall kind of angle or shift of the muscle is going to be towards the radius. And this is really actually very important to keep in mind. Here, just this angle shift. And that's present in most all the muscles. And so really spend time to think about that this week, how every muscle is working at an angle to the humerus. Brachialis, bicep, nothing is really going parallel to the bone. And it makes sense in that it would be difficult for a lot of action or activity to be evoked if we had all of those muscles just going with the bone. So against it offers the opportunity to perform a movement. And let's generalize this shape. Right, so big overall shape. Egg shape, tendon, and then we would see the tendinous expansion on this side. Now let's clean it up with some sharper lines. So these are the tendons allowing it to kind of pull. Let's start the volume a little bit lower here. This on top, down. There's our connection, tendinous expansion, brachialis still under, and coracoid-brachialis kind of covered. Here would be the split in the muscle from long to short. And again, it's not something that I always feel the need to take apart or show. Maybe on someone that's real thin, you could take this out. Otherwise, it makes perfect sense to just kind of begin with a generalized mass and then only kind of move to this state if you have to. So there's the bicep. Let's go ahead and think about its positioning here from the side. Okay, so up here on top, just this generalized egg shape from the side, and then down to here, the radius, and our stretch shape. Get some overlaps here to make sure that we see the form shifts down and in front. So nice large stretched mass. And that is our flexor group. So next week what we'll do is we'll start to talk about the tricep as the extensor, the complement. So that's kind of our cliffhanger for the week. We have the arm capable of flexing, but at this point no ability to extend it. So that will be how we pick up next week and then work our way into the extensors. But that's a lot to cover. We have our architecture and perspective layout. We have our muscles of rotation on the scapula to work on, and then the coracoid-brachialis, brachialis, and bicep. So please try to build homework from this as far as a beginning. I think with this format you could also experiment with how the trapezius will sit on top, the deltoid grabbing around this plane, the bicep integrating into the arm. Consider all of the muscles of the scapula and then into the muscles of flexion. And next week will be our final week where we conclude with the muscles of the forearm and then some ideas about rhythm as a total in the arm and the triceps, of course. So thanks for your patience and attention this week. Looking forward to seeing your assignments, and next week will be our final week.